Ouch.
You're doing great, sweetie.
Just a few more pushes, Mallory. I can see the head. You're almost there.
You're doing a great job.
Last push.
Here it comes. Congratulations. It's a boy. Wah! Wah! Mallory, that was one of the easiest deliveries I've ever been a part of. How was your pregnancy? Was it just as easy?
Well, my pregnancy wasn't as easy as that.
Ow, honey. My stomach hurts so bad.
I'm sure it's just gas. Just go to the bathroom.
No, I don't think so. I released it all. We need to go to the hospital.
What? You did?
Yes, let's go.
All right, Mallory, I'm going to take you back here into the exam room. I'm going to take your vitals, ask you a few questions here. So could you explain to me or tell me some of the symptoms that you're experiencing?
Well, I woke up out of my sleep with severe abdominal pain. And then when we got up to come to the hospital, I got very, very nauseated. When we first got to the hospital, I vomited, and then I've just been experiencing very, very severe pelvic pain.
All right, so I'll go ahead and take your vitals, and then from that we might run a few more tests to see what's going on with you.
Okay, Mallory, so I have taken your vitals. Your temperature is elevated, so that indicates a fever, and your blood pressure, heart rate, and pulse is slightly elevated. That could be due to the pain. So what we're going to do next is that we're going to run a urinalysis. So I need you to pee in this cup, get a urine sample from you.
Okay, I'll get that for you really quick.
All right, thank you.
Hi Mallory, I'm the ER doctor. I'm here to see you. The nurse tells me you woke up in a lot of pain tonight. Can you tell me a little bit about that?
Yes, severe abdominal pain. My stomach was hurting really bad, and my boyfriend said it was gas, but I released it already.
Okay, have you had a bowel movement lately?
3 hours ago.
Okay, and that didn't give you any relief from your pain?
No.
Okay, any other symptoms? You said you had nausea and vomiting. Any heartburn or chest pain or anything like that?
No, I ate hot wings yesterday. Had a little heartburn from that, but that's all.
That's all gone now?
Yes.
Okay, and your vomit, did it have any blood in it or anything like that?
No.
Okay. And so did you do anything at home to help the pain, take a hot bath or anything like that?
No, we just got up and came to the hospital.
Okay. Any chronic illnesses you deal with on a regular basis?
No.
Okay. All right. Well, I'm just going to do a physical exam. I'm going to palpate your abdomen.
Ouch! Ouch!
Can you take a deep breath for me? Okay, so it looks like, do you still have your appendix, Mallory?
Yes.
Okay, it looks like you might have some appendicitis going on. You got a fever and severe abdominal pain, so we're going to get a CAT scan while we wait on your urinalysis to come back.
Okay.
Mallory, we have some good news for you. Your appendix looks completely normal on CAT scan. We have some even better news, hopefully. Your urine test showed positive for pregnancy.
Pregnant? Those fertility treatments worked so fast.
Fertility treatments? What do you mean?
I guess the pain made that slip from my mind.
So you've had fertility treatments recently?
Yes, in the past 2 months.
Okay. All right. Well, we need to get you into ultrasound, find out how far along you are, and see if we can see any reason for this pain from the pregnancy.
Okay.
This is just a disclaimer that good doctors would have checked for pregnancy and gotten results prior to doing any radiographic examinations.
Hi, Mallory. I'm going to be performing your ultrasound today so you can see what's going on in there with your little baby. You can watch everything on the screen right here. But before we do the ultrasound, I'm going to have to squirt a little jelly on your stomach, and it might be cold.
Oh, that is cold.
I told you. Now, I'm going to use this ultrasound probe in order to see what's going on in there.
Is that the baby?
That is the baby. But
Wow.
I see something suspicious
suspicious. I'm gonna have to take a closer look.
All right, Mallory, congratulations. We found a 6-week, 2-day pregnancy inside your uterus, so that's good. You do not have a tubal pregnancy. What we did find that's causing your pain, though, is what we call an ovarian torsion.
What?
An ovarian torsion is when the ovary kind of moves around in there and gets twisted up, and the blood supply stops flowing to the ovary, and that causes severe pain. And we really need to get you into emergency surgery.
Surgery?
Yes, that's the only way we can treat this.
What about the baby?
The baby will be okay. We'll make sure to keep the baby okay, but we need to get this ovary untwisted so that blood can continue to flow to it and keep it oxygenated and nourished so that it won't die, so that tissue won't die. So we're going to get the OR set up and start prepping you. The nurses are going to come in. There's going to be a lot of activity. We'll get Maximus in here to be with you until we get you back to surgery. And before you know it, you'll be back in the recovery room, excited about your pregnancy.
Okay.
Beep, 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 beep.
We're gonna go in laparoscopically today through our belly button just to see what we have going on with this torsed ovary. Instruments, please.
Mallory, you had a great surgery. Things went well. Baby still looks really, really good inside there. We have a good heartbeat. And your ovary, we were able to save your ovary. The surgeon was able to get in there and untwist it. What happened with your fertility treatments, you developed some severe, pretty large cysts on your ovary, and the weight of those cysts caused the ovary to twist and developed that ovarian torsion. So I'm glad you came in really quickly like you did. And we were able to get that fixed so quickly. So now you have a nice healthy ovary, and you also have a nice healthy 6-week, 2-day pregnancy. Do you think it'll be a boy or a girl?
Yeah, I don't know, Doc.
Not sure yet. Got a few weeks before you find out. So why don't you rest? Maximus went to get something to eat, so he'll be back shortly, and I'll see you again tomorrow.
All right.
Wow, Mallory, that was quite the start to your pregnancy. I'm glad that everything else went well and that we have a healthy mom and a healthy baby.
Yeah, me too. At least I'll never have to deal with this again.
Well, actually, since you've already had ovarian torsion, you're at a greater risk to get it again.
What the?